This is Rick Thornton with Insurance for Dallas, and this is a series of 5 videos showing you how to use our simple e-application to sign up for health insurance. Use this video to select a plan. The first thing we want to do is we want to enter our zip code. Okay, this screen may or may not come up depending on whether or not your zip code is competing for a county. In this case, I'm in Denton County. Now, over here on our left, who needs coverage? I'm going to add 3 persons for this example. We're going to have a family of 3. I'm going to make the primary, which we'll say is male. I'll make him 45 years old. I'll make his wife 40 years old. And I'll keep the child in at 15. Now, if it was an adult and 2 children, what you want to do is remove the spouse from coverage and then add a child. I'm going to put it back like we had it before. The next thing we want to do is we want to put in annualized income. So this is going to be the income that the household brings in. This would include the both parents, or the mother and father, or a husband and wife. So I'm going to put the income in here as $80,000. And I purposely chose this number because if you notice, at $80,000 for a family of 3, there's no monthly savings, and as you can see here, there is no subsidy. Now what I'm going to do, I'm going to have the annual income go down to about $25,000. You can see with $25,000 worth of annual income, the subsidy here is $576. So what does that mean? That means that the federal government will be giving you a tax credit of $576 per month to help pay for health insurance. You'll also notice on the left here that the child qualifies for CHIP all the way up until his 19th birthday. So here we have $576 per month, and as we scroll down, we will notice what the monthly payments are associated with this particular subsidy. Here are the monthly payments for this United Healthcare plan. There is a 0 monthly payment. The deductible, however, is $4,900 a month. More details: the out-of-pocket limit is $6,450 per month, which includes that deductible. So what does that mean? That means if your total bill per person with I believe it's a 2-family max with this, if your total bill comes out to $1 million, you'll never exceed $6,450 a year for that person. I'm going to close that. Now, your biggest bang for your buck is going to be with your silver plan. So I'm going to click on silver and I'll show you why. Now, if you look at your silver plans, at this income, and that's important, at this income, you will notice we're still getting the same subsidy. The price is $19 a month. However, look at the deductible. The deductible has gone down to $500 per person with a $500 max per person. So we've actually reduced the deductible by going to a silver plan. All plans are based on the second highest silver plan in your zip code. So everything is targeted around silver plans. So as we scroll down, you notice here's a plan that has 0 deductible with an out-of-pocket of $500. This may be a good plan for that family. The cost to go see a doctor is $20. The cost to go see a specialist is $40. The cost for an ER visit is $500 and 20% after deductible, which means you would have already spent your out-of-pocket maximum here. So as we scroll down, we can see what we have on the silver plans, and we can see what some of the deductibles look like. Here's a $100 deductible with an out-of-pocket max of $550. But look, The doctor's office visit, instead of being $20 that you saw before, is now $10. So there's a variety of different plans here that you can choose from, and that is going to be based on you going to the silver plans to get your plan, your insurance policy. Okay. I just want to show you some of the buttons over here on your left. You can come over here and you can choose your provider. So if you wanted to target, say, only Blue Cross Blue Shield, uncheck these others, and what we have left is only your Blue Cross Blue Shield plans. If you wanted to go to say a less expensive plan, and you wanted to say only do bronze plans. No, bronze plans are going to keep your deductibles high, but the price is going to be less. So you can see $0 here. You would probably get a bronze plans if you don't plan on using your policy at all during the year, or you're just getting this to fulfill the Affordable Care Act's mandate for health insurance. Over here, you have your different networks. You have your EPO, PPO, POS, and HMO. We also have videos on our website that explain how each one of these work and the definitions of each one. Okay? All right, so that's so much for this video. This will give you a good idea of how to go about selecting a plan. One more thing before I tune out here. I'm going to actually put this down to $19,000 to make a point. Now, at $19,000, Medicare is actually supposed to kick in for this family of three. Excuse me, Medicaid is supposed to kick in for this family of three. However, Texas does not have Medicaid. So if you notice, no monthly savings. So in this case, unfortunately, this family would have to pay the full price on all of the plans if their total monthly income is less than, it's about $19,700, I believe. Let me put in 700 to see if that's the 700. Let's go to 800 and see where it is. So it's about $19,800. If your total annual income is less than that, then you won't get a subsidy. You're supposed to go to Medicaid. Again, Texas does not have Medicaid, and just have to pay the total amount, unfortunately. Okay? That concludes this video. Our next video will be on understanding the plan you choose.